Drug abuse, cancer,
measles, diabetes, AIDS, cancer.
Good evening once again, folks. The time moving in now to just about 16 minutes onto the hour of 9 o'clock. It is time for Doctor on Call, and we want to welcome back all our viewers of GBN Television, Channel 7 and 11, and of course K105 FM. We've been off for a couple of programs due to the CPL, and this is our first program after all of the cricket excitement. So we are very pleased to be back, and we are also happy to have you with us this evening. This evening, as I told you earlier, we will be looking at childhood cancer. We have with us Dr. Allison Burnette and also Mr. Ernie James, and he is from the Lions Club. Now, the club has an initiative where they are looking at the issue of childhood cancer. It is a very serious one. Sometimes, we all know cancer is very serious, and the pain it can cause to not just the patient, but families and loved ones and all of that. And, in a child, when it manifests in a child, it's even a little harder to deal with. So we're going to speak on that this evening. But first, let me welcome my guest, and I would start with the gentleman first. We say we always leave the very best for last. No offense, Ernie, but Mr. James from the Lions Club, we welcome you to the program, and we're very happy to have you.
All right. Thank you very much, and good evening to you and all your listeners out there all over the world. It's a pleasure for me to be on the program on behalf of the St. George's Lions Club. So I just want to say thank you.
You're very welcome. And of course, Dr. Allison Burnette, I don't recall having you on the program before, so I'm very elated to have you for the first time with me, and I trust we'll have a wonderful time. So we welcome you to Doctor and Call.
Thank you very much, and good night to you and the listeners.
All right. Let me start with Mr. James. Tell us about the initiative of your club as it relates to childhood cancer.
Right. Before I get into the issue of childhood cancer and why we are undertaking this initiative, first of all, the St. George's Lions Club is a charitable organization, and we are a part of Lions Club International, where you have clubs all over the world, basically. And our main aim is to deal with charitable issues and to help people who are in need. At the international level, we have some focus areas which we normally look at. For example, we look at youth, helping develop the young people, disaster relief. We also look at diabetes, hunger, the environment. And now we have this initiative where we look at childhood cancer. As you may know, childhood cancer is a serious issue that we as a club, we have to deal with over the next couple of years in terms of helping persons to fight childhood cancer and also persons who lost the fight, how to cope with this thing going forward. So this month, the month of September, is celebrated as childhood cancer. And the Lions Club, both in Grenada, St. George's Lions Club, and clubs all over the world take on different initiatives in order to build awareness of childhood cancer so that persons could have more information and be able to cope and to deal with it. An important thing of childhood cancer for the month of September is the symbol, which is a gold ribbon. We are encouraging persons to wear that gold ribbon to show that you really care about childhood cancer and the fight against childhood cancer. So basically the club came up with some initiative, and one of that initiative is really to build public awareness, and that is why we partner, or we got on board, we discussed with Dr. Burnette so that she can be on this program to educate the public and make them more aware of childhood cancer. So in a nutshell, that's what the Lions Club is about, and that is what we are dealing with during this month for childhood cancer.
Okay, thank you, Ernie, and I will come back to you through the course of the program to talk a little bit about the work that you do in the club as it relates to all of these health initiatives. Dr. Burnette, the main issue at hand, childhood cancer. Of course, when we hear that, probably the first thing that comes to mind is cancer in children. But as a medical practitioner, tell us exactly what is childhood cancer. And I also want us to discuss as we go on some of the main types of cancers that affect children and how we treat them and so on. So we take them in stages, first talking briefly about what is childhood cancer.
Okay, well, what I do is first look at cancers in general. What is cancer and why do we get cancers? So when you're looking at cancer, if we look at the cells, for example, as cancer is an abnormally behaving cell. So your cells in your body, they all duplicate themselves. So after a while, they will split, they will form new cells, they will replace the ones that have died. And if you have an injury, they continue to grow until they heal that injury and then they stop growing. Now, there are signs that, there are certain receptors that they have, certain things that will recognize it's time to stop growing, and then they stop growing. So if, for example, you get a cut and it's going to heal, then the cells will continue to grow until that cut heals and then it stops growing. Now, with the cancer cells, that sensitivity to recognize this is the time to start growing, this is the time to stop growing, they have lost all of that. In addition to that, the different cells in the different tissues have specific function. So the cells in your heart behave differently from the cells in your lungs, which behave differently from the cells in your brain. So brain cells know I'm brain, this is what I'm supposed to do. Heart cells know this is heart, this is what I'm supposed to do. So in addition to losing the information about when do I grow, when do I stop growing, they also lose the information in terms of what do I do. So they start growing rapidly and I spend so much time growing, I forget what I'm supposed to do. So then you have these cells that grow and they take over the normal cells and then they're non-functional. So basically this is how we get cancers. Now, why does this happen to certain persons? Why doesn't it happen to other persons? Interestingly enough, as our cells multiply, some of these cells do break out and start behaving abnormally, but your body has a mechanism to recognize, hey, you're misbehaving, you're behaving incorrectly, and I remove you, and therefore you no longer grow. But somehow these cancer cells evade that mechanism, they don't get removed, and they continue to grow. We can look at the factors that affect them in two categories. One is things we have no control over. So the genetic predisposition, for example, when the genes that cause it, we have no control over that. Your age, as you get older, then it is more likely for this process to happen, so you are more likely to get cancer. Whether you're male or female, there are certain cancers that are more you'll get in males, you get in females, so that you cannot control. So that is out of it. There are some factors that we can control in terms of why do we get the cancers. So the commonest one that we all know is smoking. So yes, smoking will help to cause these abnormal changes, but that is something you can control, you can prevent it. Cancer of the colon, for example, that is also one that you for most persons you can control in terms of looking at your diet, etc., and you can get rid of those. So you have some factors that are controllable, and there's some factors that are not controllable, and they end up with these cancers. So with childhood cancers, then what we'll find is that most of these cancers, they are caused by more of the uncontrollable factors. So for example, like smoking causing the cancer, your diet, your lifestyle, etc. The cancers that we see in children tend to be not to be associated with our lifestyle, etc. So they're more of the spontaneous ones that will come up. Also, the cancers we see in children are different from the ones that we will see in the adults. So as I mentioned, cancer of the colon we see commonly in the older persons. We don't see that in the children. Lung cancer related to smoking, we see predominantly in the older persons. We don't see it in the younger persons. Breast cancers, cancer of the cervix, etc., we see in the older persons. We don't see it in the younger persons. So the cancers we see in the younger persons are usually the ones in the brains, the ones associated with the your blood cells, etc. So the types of cancer we see are different, but the basic underlying mechanism falls into the two categories.
Okay. At what age? Because we're talking children here. Can a child, let's say a parent has cancer. For some reason, it wasn't discovered late, and that mother happened to have had that child. Can that child, that growing child, can that child be born with the cells from the mother? Sort of inherit it?
Yes and no. So because the mother had the cancer cells during the pregnancy, that is not what caused the child to get it. So it's not like the cancer cells are there growing in the mother and then it crosses over and it goes in the child. No, that's not the way it goes. But there are certain cancers that we say have a genetic predisposition. So the gene pool that the child gets, the gene that the child is going to get, some are going to come from the mother, some are going to come from the father. So if the mother has the genes that predisposes to cancer, and the child inherits those genes, then the child, will have the predisposition to the cancer. But having the predisposition to the cancer doesn't necessarily mean you're going to get the cancer also. So you may have the genes, but it never breaks out into the cancer in you. But you have your sister, your brother also gets the gene, and it breaks out into the cancer in them, but it didn't break out in you. So there are other factors that mitigate, that will help to promote it, and some that will help to prevent it.
Okay. What are some of the most common types you've seen in children?
Well, the commonest cancer we see in children worldwide and in the Caribbean, in Grenada, is the cancer in the blood, your leukemia. Mm-hmm. That is the most common cancer that we will see in the children.
Kindly explain that a bit. Cancer in the blood. How? I mean, your blood is constantly flowing. The heart pumps blood. It's flowing to the various parts of the body. How does it happen? it's liquid.
Yes. Why didn't the kidney get rid of it? Why did the liver get rid of it when we say the liver and the kidney gets rid of impurities in the blood? So why didn't it get rid of these cancer cells also? Let's go back to what I said in the beginning. Remember, why do we get the cancer cells? Something goes wrong. They start multiplying and don't recognize that they're supposed to stop. And then they also forget what they're going to do. So the cells that you have in the blood, they are produced from your bone marrow. So the bone marrow produces these blood cells. It sends it out in the blood. It circulates. After a while, it gets old. The cells get old. They die, and the bone marrow sends more cells to replace them, and it continues like that. The process for the leukemia, the cancer in the blood, starts in the bone marrow, not what's circulating. Okay. So in the bone marrow, as these cells start to multiply, then you get a group which something goes wrong. They start multiplying faster. They don't stop multiplying, and then they don't function. So you get lots of them, but they don't know what to do and they don't function, and they start replacing the normal ones that you should have. No, so when your normal cells start circulating, get old and die, and they're supposed to be replaced, what the bone marrow has now are these abnormal cells. So as they multiply, they send them out in the blood, and more get in the blood. And as the numbers increase in the blood, then we start seeing the signs and the symptoms, because the blood then stops doing what it should do, because now you're having too many of these abnormal cells coming out of the bone marrow and going into the blood.
Okay, just as an aside, cancer generally, can someone have two types of cancer at the same time? Is it possible? Have you ever come across that in your profession?
It's possible, but extremely rare that you will get two different types of cancer at the same time. You may have one cancer, you get cured of that cancer, and you develop another cancer afterwards. So that is more common to see than the two cancers occurring at the same time.
At the same time. Okay. Aside from leukemia, what other types we see in children a bit?
Okay, so we also see the tumor, the cancers in the brain. So we see the brain cancers, and for the children, the brain cancers we see more commonly are the ones to the back of the brain, or the back of your brain is what controls your balance and your walking, etc. So those are the ones that we see more commonly in terms of brain cancers for the children. We also see the cancers in the lymph nodes, the glands, which is a bit related to the ones in the blood. So you have the blood cancers, the leukemias, you have the ones in the glands, the lymphomas that we see. You also see cancers in the kidneys. So you have your Wilms tumor, your nephroblastomas that you will see. You can see cancers from the nervous system, so you get your neuroblastomas as well. So these are the ones, the bone cancers as well, we can see in the children. So these are the ones that we see commonly.
Okay, and as it relates to the neuroblastoma, that type, does it start developing in the embryo? I mean, even while the child is in there?
It can. So the younger, generally, the younger the cancer starts, the worse it is, the more aggressive it is. So when we are seeing the youngest child I've seen with a neuroblastoma, I think was 5 months old or something like that. So when we see them that young, the tumors are usually extremely aggressive and unfortunately difficult to control.
Okay. Now, in terms of, children, they're very young, very fragile. How do you identify it? In a case, let's say with the neuroblastoma, a 5-month-old baby, how do you identify that type of cancer in a child that young?
Okay, so the younger child, that's the thing too. it's more aggressive and it's more difficult, because for the older children, then you're looking at their response to the cancer. So if they have, for example, the leukemia, then the blood starts functioning abnormally. So your blood count might get low, so the child becomes weak, the child looks pale, the clotting factors start decreasing, so you see little spots coming up, etc. Now, for the child is also walking, so that if they have a brain tumor, it's affecting them. You notice they're not walking properly. They seem to not to be seeing properly, etc. But for the younger child, it's difficult. Usually when we see cancers in the younger child and we're recognizing it, we're seeing an abnormal growth, a mass that shouldn't be there. So the mother may come and tell you, well, I'm feeling, it feels funny that the child's tummy shouldn't feel like that, but it feels like something hard is in the stomach and I don't know what it is. Or I'm seeing something looking funny on the neck and it feels hard. So they will come in, it's as it grows and you are seeing the mass of the cancer that it usually shows up itself.
Okay, wonderful. All right, so Doc, we're going to take our first commercial break now. When we come back, I want us to look a little bit at how do we treat some of these cancers in children, and then we'd go on to, children who survive it, how do we deal with them? So stay with us. We'll take a short break, and then we will be right back.
It's new, innovative and classy, and a cut above the rest. Your one-stop shop for bathtubs, kitchenette, customized doors and windows, and even a new paint job. We also sell quartz and solid surface countertops. At M&N Hardware, we offer best prices, excellent service, efficiency, and reliability. Visit us at Dusty Highway, Grandin, St. George, or call telephone number 440-6757. M&N Hardware, from foundation to roof. Let's build together.
At Communal, we are adapting to meet the changing needs of our shareholders and members. Times are changing, and with the changing times comes a whole new way to do business. Our parents may have done their banking a different way. Communal's state-of-the-art online banking and international debit card allows members to do business with great ease. It's like literally having a branch in your very own hands. Need a loan? Apply online from the comfort of your own home anywhere in the world, and your request will be dealt with remotely. Want to transfer between your accounts or another shareholder? No wait time for transactions to update. Voila! Who needs receipts when you can receive them via e-statements on your mobile device and save the environment? Not a Communal member? You can join our family today by applying online. At Communal, we see you working hard to ensure that you save, invest, and grow. Communal. Join us today. This will be the best financial decision you have ever made.
Ofio.com. Sale. All the outlets, hotspot outlets. You're going to go to the Carnage, the Grenville, or the Sutter's hotspot, and you get sales and deals on all items. You can get these on potato, you can get these on saltfish, onion, garlic, mackerel, toilet paper, and we even have the currants and the raisin at $10 per pound, lowest price island-wide. So people just come down or go up or go across, but just make sure and go to hotspots.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Reading is too hard. Reading school books is lame. I'd rather read about children like me and cool things. I can read, but sometimes I don't even know why I have to. It makes no sense.
Why can't we read about things we like?
Reading is the key to unlocking all learning and ensuring that children reach their potential. Here's what the children have to say.
Make reading fun.
Teach me how to read, but let me practice reading with things I like to read. Talk with me and read with me at least for a short time every day.
Let me tell you my own stories.
Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, you play your part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development.
Welcome back, folks. It's Doctrine Call, and we're looking at childhood cancer. In case you just joined us, we have with us Mr. Ernie James from the Lions Club and Dr. Burnette. She is our doctor on call this evening. So, Doc, if a parent comes to you and says, Doctor, how can I prevent my child from getting cancer? What would you say to that parent?
That's a very hard one, because I'd probably have to tell them, no, I can't help you to prevent it. Mm-hmm. Because the factors that cause cancers in the children, as I said, they're not related to lifestyle. Mm-hmm. So there are some of these spontaneous changes that come up. So what you need to do is pay attention to your child, trying to find it, identify it early, but it's not so much prevention. When we talk about prevention of cancers in children, we're talking about teaching them good habits that will help them to prevent cancers later on in life. So teaching them about exercise, eating properly, avoiding smoking. It's not going to stop the cancers that they'll develop in childhood, but when they become adults, what they have learned from childhood, they take it across, and they would be preventing those. So for the cancers that occur in the children during childhood, the important thing is to recognize it early. And you can recognize it early by paying attention to your child and listening to your child. So if the child is coming, you tell the child to go and do something, and it's, Mommy, I'm tired, and you're a lazy child, go do it. And they come in, they're always, Mommy, I'm tired, and you're looking for an excuse. If they say it to you once, yes, maybe they will say it once. But if they're saying it frequently, stop and think. Children are not normally just lazy, hiding from stuff. Children like to be involved. They like to do things. So when the child is saying, my hand hurts, my leg hurts, I feel pain, I feel weak, I feel tired, I don't feel like playing, listen to these things. Or you notice that they are walking and they're walking funny, and the child is saying, child, walk properly, stop it. They're not doing it purposely. They're saying, but Mommy, I can't. Yes, you can. So before you start, yes, you can. Straighten yourself up. If you see them doing things out of the way that is continuing for too long. Look at it, get somebody to check it out and see what is happening. If your child is getting a fever and an infection too often, if your child, you'll say the blood is weak, the child is looking pale, the child is getting anemic, before you just run and buy iron tonic to give to the child, then, take the child to the health center, to the doctor, let them do a basic blood test that we can see, yes, it's iron that they need and it's not something else that's going wrong inside the blood.
Okay. We often hear the term screening. A 3 or 4-year-old child, is it recommended to do, let's say, a screening for a child, just in case there might be something?
The child should have, I prefer to use the term, checkups rather than screening.
Okay.
And so when, we're excited about our babies, and when our babies are born, every time the nurse says, bring the baby to the clinic, we're there. So we carry them at 1 month, and we carry them at 2 months, and we carry them at 4 months, and it is not a problem. But then they start running around and they're fine, and you forget it. So nurse says, come back, and you're like, but the child is okay. So at these regular checks, not when the child, apart from when the child is sick. So once the child has finished their immunizations, they've gotten all their vaccinations and they're okay and they're bigger, then we should get at least once a year, the child should have a checkup to make sure that the child is growing properly, that everything is okay with the child. And at these checks, these annual checks that we do on the children, then we can at times pick things up early. So it is important, once a child has finished their vaccines and they're growing older, that you still follow the regular checks and at least once a year get a checkup for your child. An easy way to do it is at the end of summer. The end of summer, you're going to be buying school books, you're buying school uniform, you're doing all of that. Just add in the doctor's check. I'll get my dental check, I'll get my doctor's check as well. And you add it in there where it becomes a little package, and you will be able to pick up things earlier. If you pick up the cancers early, then it's much better. Although we can't prevent it per se because of lifestyle, etc. If we pick it up early, then it makes a difference, because a lot of these childhood cancers, if we identify them early and we can treat them, then we can cure them.
Stand a better chance, yes.
Something that we associated with the word cancer. As you hear cancer, you're thinking the person will die. But if we identify it early and we treat it appropriately, then we can get rid of it. We can have persons who are cured.
Okay, wonderful. Now, I want us to go on and talk about the treatment, but Ernie is looking a little lonely there, so let me just get him involved. Ernie, I don't want you to fall asleep there. But your club, tell us a little bit about the initiative, because you spoke about awareness, and of course tonight having Dr. Burnette with us, a way of making the public aware of that. What are some of the other initiatives and activities you have planned as it relates to childhood cancer?
Okay, well, Godfrey, as I mentioned before, the awareness, we held a Zumba workshop for the kids last weekend. It was well attended, and the children embraced it, and we plan to do other similar activities during this month. We also have little brochures distributed to the public, especially to the kids and parents, so that they may be aware of childhood cancer and what to look for and how to handle it both emotionally and financially. We also have other initiatives where we post on Facebook and other social media platforms to build awareness. And that's basically what we do, or what we have planned for this month. We also partner with other organizations in terms of raising awareness and raising funds, because funds, we really need funds in order to help, especially family who are in need, because cancer treatment can be very expensive, and persons in need, they need certain assistance to deal with it, and that's where the Lions Club comes in.
Okay, wonderful. So I want to come back to Dr. Burnette, and let's speak about treatment. We just basically introduced it just before I went to Ernie. So we've identified cancer in a child. Let's start with, let's say, a brain tumor. How do we go about treating that? Because that child, very young, very tender, in the development stage, so the muscles, the organs, everything are young, and all of that. What kind of treatment would we use in attacking that cancer at that early stage?
Okay, for the brain cancers, depending on where the cancer is, then the main treatment is surgery. So we can identify where the cancer is and we can remove it. There are a few times when, because of where the position is, we cannot get to it, we cannot remove it, and then we have to look at predominantly depending on radiotherapy, radiation to the cancer, so that we can control it. But the main thing would be surgery. The three basic approaches that we use in terms of cancer treatment is the medication, so your chemotherapy, we have the radiation, so you have your radiotherapy, and surgery. Mm-hmm. So these are the three main modalities that we use in terms of controlling the cancers.
Okay, but when do you use either of them? Well, we did mention, based on, if it's a brain tumor, depending on the location, you would use surgery. When would you use, let's say, radiation or chemotherapy, or both, or all three for that matter?
It depends on the type of cancer. Mm-hmm. So it's the type of, one, the type of cancer, two, how big is it, and three, how aggressive or how rapidly it is growing. And that will determine which is the method that we use, how much of it we use, and whether we use a combination or one or all three.
Mm-hmm, mm-hmm. Let's say leukemia, for example. What would you use in this case?
Okay, for our leukemias, once we identify it, our main treatment is with our chemotherapy. So we will do our chemotherapy for our leukemias. There's some patients with the leukemias that we will also need to do radiotherapy for them as well. Mm-hmm. Previously, it was routine that patients with leukemia, they would get both chemotherapy and radiotherapy, because we recognize that the cancer cells sometimes hides out like in the brain, and for the males like in the testicles and areas like that. So we would use radiotherapy to treat these areas to make sure that we kill those cancers there. But we did very well with that, and our children were surviving. So we were killing all the cancer cells and they were surviving. But the next thing we noticed is that, yes, they survived, but then later on they started developing other cancers. And this was because of the radiotherapy, the radiation. So too much radiation can cause the cells, another type of cancer to develop. So now that they're surviving and we're seeing the complications, then radiotherapy is not done for everybody anymore. And then we now have the skill to target the radiotherapy. So we're given less radiation and we can target the specific site. So we can know it is this specific site in the brain that we're sending it to, and not just like generally everywhere that we're doing the radiation. And therefore we will decrease those kinds of complications.
Okay. In terms of side effects, what are some of the side effects that the patient can experience, let's say from chemotherapy and radiotherapy?
Okay, from chemotherapy, the first thing that the children will tell you, I hate it. It makes me feel sick. I vomit. I mean, they lose their hair, but losing the hair surprisingly doesn't bother them as much as the how they feel, the nausea, the vomiting that they get, and it lasts for like a day or so after they've been given the chemotherapy. So that part of it is really bad. They, like I said, they will lose their hair as well, because what what the treatment is doing. Remember, I said these cells are forgetting to stop growing rapidly. So the treatment we give is targeting cells that grow very rapidly to kill the ones that are growing rapidly, but don't kill the ones that are growing normally. So like things like your hair also grows rapidly. So your hair, that's why your hair falls off, because unfortunately it gets caught in you're growing rapidly and taking out what is growing rapidly. So you will lose the hair with it. So that's some of the side effects that you may see. The actual blood count itself may go very low, and then because of that, it makes you more prone to getting infections that other people wouldn't get. So when we are giving you the therapy, we also need to monitor your blood to make sure that it doesn't fall too low. So we did a good job of getting rid of the cancer cell, but we also did a good job of making you susceptible to infection that causes another problem. So the cure should never be worse than the treatment.
Right,
so
right.
Have to monitor those things as well. With the radiotherapy, our main concern is like controlling the dose so that we don't end up curing the first cancer and developing a second cancer. They can get also radiation burns. So the area that you're targeting, apart from the cancer itself, the cells around it might get damaged as well. So that is something that we will see as well. That also you have to do in terms of making your therapy suit the individual themselves and not just a blanket therapy for everybody, because depending on how your body is set up, then I may need to give you a different combination and a different dose from somebody else.
Okay, wonderful. You mentioned that the treatment targets the cells that grow very fast, and you made a mention of the hair. What about the fingernails? Because fingernails do grow fast. Does it affect your fingernails as well? Things like that?
Yes, it can.
Okay.
It can, but the hair, it tends to affect the hair follicles more than things like your fingernails. So that and that also is the more obvious one. So like if your nail doesn't grow as fast as it used to grow, it just means you don't have to cut your nails so often.
All right.
But when your hair starts falling out, that's very obvious.
Yes, indeed. Okay, so after we administer treatment for that, the next step is caring for the child. What sort of advice is given to the parents, and in terms of you as a physician who is treating the child? Let's talk a little bit about that process.
Okay, that's a very important area also. Looking at talking with the parents, telling them what to expect and how to deal with the child, and involving the child in terms of the discussion and what is going to happen. Children at different ages understand at different levels, but they all understand. And we encourage the parents to let the child know about it, let the child know what is going to happen to them, and let them be a part of it so they don't feel so lost and helpless. I am a part of this management and I'm important in it. So it makes them more comfortable, it makes them feel safer, and also to let the parents know that it's okay to be angry. It's okay to be frustrated, and that's why we are here. So at times when you're overwhelmed, then call us up and come in, let us talk. And you might need, we don't have, say, a hospice care per se, but if, we can make arrangement that you need a break, okay, we'll bring the child and put the child in a safe place. You can get a break. So we have a discussion with you about the management and what's going to happen, and you involve the child. Mm-hmm. What I have seen is that children that are involved in their management do a lot better. Okay. Mm-hmm. I remember one child where the parents decided we're not going to tell this child anything. it's I don't want to hurt my child by telling my child you have cancer and you're going to die. So that is my burden to carry, and I'm not telling the child. And that child, I was so angry because the child could not understand what was happening. And to my mind, that child had such a worse outcome. The child died eventually because it was a very aggressive cancer. Mm-hmm. But the child was so lost and so angry because they did not understand, as compared to another parent where we discussed and they said, okay, I don't think I can do it, but can you do it for me? Mm-hmm. So we sat with a parent and with a child and we spoke with them. And that child was so different because it turned out that this child at times was the encourager for the parent. Right. When the were looking at her and they were so depressed, and he said, Daddy, don't worry. I will even when I'm gone, I will take care of you. And, it was such a difference in terms of the end and the comfort of the child and what is happening. So involve the child in what is happening. Talk with the child and get help, get support. Parents who are going through have gone through similar problems, you can talk to them. They can tell you, well, what works for me, what doesn't work. And like I said, when things get too heavy for you, call your doctor. Okay, we make an exception for you. You can call anytime, anywhere, because we know what's happening.
Yes, it's a difficult one.
Yes.
Okay, so we'll take our final commercial break. When we come back, the telephone line is going already. So when we come back from the break, we'll accommodate some of our callers and take some of the questions or comments that they have. So stay with us, folks. We'll be back with you in just a moment.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Welcome back. It's Doctor and Call. Doc, just before we go to the phone, we've heard of cancer having different stages. In children, how do we grade the cancer?
Okay, so yes, we look at the cancer in terms of where is the origin of the cancer. So if you're looking, for example, cancer that is in the kidneys. So is the cancer, all the cancer inside the kidneys and it hasn't spread to go outside of the kidneys? All right, so is the cancer in the kidneys and it is just now spreading outside of the kidneys to the tissues next to the kidneys? Has the cancer spread to go in the blood and it is going elsewhere? So has it gone to the brain? Has it gone to the lungs? Has it gone, for the rest of the body? So depending on that, we'll give the stage. Stage 1 being the one that's at the beginning. So we have your stage 1, your stage 2, your stage 3, and stage 4. When it is at stage 4, it basically has spread everywhere. So the ideal situation is to catch your cancer in the stage 1. And that's why it is important in terms of, looking at the complaints of your child, getting it checked early, and doing your annual checks for the child so we can pick it up early.
Okay. Let me ask this. So we speak of the cancer cells growing very fast and replacing the other cells, but how does that actually bring on the death of an individual?
Okay, so when you're looking at it, so if you're looking at your kidneys, when your kidneys fail, then, eventually persons with kidney failure will die unless they're going on dialysis. Mm-hmm. So when your kidneys fail, in order to keep you alive, we put you on dialysis where we give you a kidney outside of you that does the job, or we do a kidney transplant. No, if we don't do that, because the kidney doesn't function anymore, you're gonna die. For the person who has the cancer, the unfortunate thing is when they get to that stage, even if you can't put them on the machine because they have the abnormal cells there, and although you clean the machine, sometimes that one cell that hides somewhere in a little corner that you don't get, if you put somebody else on that machine and that one cell goes there, then that can spread it to somebody else because it's like I'm injecting you with my cancer. Mm-hmm. So that happens. So you can't put them on the dialysis machine. If you're going to take out their kidneys and give them a new kidney, the cancer has spread outside of the kidneys already. So when you take out that kidney and you put in the new kidney, then the cancers that went outside are going to come in the new kidney and they're going to destroy it. So then, at that point, we have pretty much lost you in terms of getting control. So like the person's in the stage 4, where it has spread to everywhere and all the organs now can't work normally. It has spread to your lungs. So it's spread from your kidneys, gone to your lungs. Your kidneys are not working, your lungs are not working. It's spread to the brain. Now the brain starts getting affected, etc. So once it starts going around and all the organs start going down, then eventually it is going to take you out.
Okay. Because you can't function as you would like to.
No, you can't.
All right. So what we're going to do now, open our telephone line. The number, folks, 435-2041. Again, 435-2041. If you have any questions that you would like to ask the doctor, or you would like to put to the representative from the Lions Club, you can do so now. We're discussing childhood cancer. You probably have an experience that you would like to share with us. You can give us a call, 435-2041. That's the number, and we will be happy to accommodate you. All right. In the meantime, Doc, some of the tests that are done to identify cancers in children, and let's extend it a bit generally, what are some of these tests that are done?
Okay, so extending it generally, including the adults, then you have your screening test that you can do. So as an adult, then when you're in certain age group, you should have your screening test done. So men, please go and do your screening for your prostate cancer. Ladies, go and do your screening for your breast cancer. Do your pap smear that we can get these tests done. We can also screen for the cancer of the colon. So, do your annual checks and get these tests done so that we can see them in the very early stages. So if you're going to get cancer, catch it in stage 1. And the screening helps you to do that, and then you can intervene and cure it. So that's for your screening test. In terms of identifying the cancer and then determining the treatment, then there are various things. You have your blood tests that you will do to look at what is happening in the blood. You can do scans and x-rays to look at it. You can get tissue samples as well. So you can get a biopsy. So if it's in the liver or in the kidneys, in the bone marrow, we will get the tissue and have a look at the tissue itself. So we will know what type of cancer it is, how bad it is, so where it has spread to, how aggressive it is. So is this, the more immature, the more information the cell has lost, then, it's more immature and more basic, then the worse it is. So if you have the cells that, they've just lost all their function, they don't know when to stop multiplying, they don't know how to interact with the cells beside them. They don't know what they're supposed to do. Inside the cells, everything that is inside there has gone haywire. Then that, more problems than the ones that have just started going wrong. So we look at not only what type of cancer, but what does a cell look like in terms of its behavior. And that helps us to determine, that also helps in terms of the staging. So we will know what stage it is at and therefore what is the best treatment for it.
Okay, wonderful indeed. We've heard of things like endoscopy and PET scan and MRIs and all of these things. When are some of these used, in identifying what the problem is and where they are?
Okay, so in terms of your endoscopy, then that is looking at cancers in your digestive system.
Okay.
So if we're seeing things that are abnormal and we want a closer look at it, then we can do the scoping. We can also do what is called bronchoscopy, where we look down inside the lungs and we can see what is inside the lungs. Now, in terms of the PET scan and the MRI scan, those are belong to the radiology department, so they're different types of scan. It's like a more sophisticated form to the X-ray, to put it very simple. So the X-ray picks up the basic. The MRI can pick up more detail. The PET scan picks up even more details that you can see. So these can give you, really detailed. The PET scan, for example, is very helpful in monitoring our patients with cancer. So these cells, we say sometimes these cancer cells goes into the small areas and they hide away. So this is when the person, you're doing all the tests, you do everything and everything is negative, and the person gets so angry. Doctor said, I was okay. They didn't see any cancer cell, and now 6 months later, I'm finding it because the cancer was hiding in some little corner that the test we are doing can't find it. Our PET scan gives us even more detail. So the ones that we would miss on the routine, the PET scan would do it. So, in terms of one of the challenges we have is when a person has done very well on their treatment, and now the question is, are they cured? Cured. They've gone 5 years, they've gone 7 years. We're not seeing any cells. Can we say they're cured? Can we stop their treatment? And it's always at the back of your mind, are there a few cells hiding somewhere that we can't see? So if we had continued a small amount of chemotherapy, then we would have controlled it, we would have gotten rid of it. But because we didn't see it, we weren't able to do that. And then it flares up somewhere else. The PET scan helps us to, help to prevent and pick it up.
Okay. We mentioned it early, very early in the program. When people hear of cancer, someone has cancer, they tend to think, all right, well, that's it. That's a death sentence. Your thoughts?
No, it isn't.
All right, great.
Maybe 30, 40 years ago, yes, that would be correct. But no, cancer isn't a death sentence, and that we need to emphasize. Cancer is not a death sentence. We have treatment, and yes, you can cure cancer. You can. It's picking it up early enough, identifying it early enough, and give them the correct treatment. So for the children, again, I emphasize, listen to your child, know your child, and recognize there is something wrong with my child. And therefore come in, do your annual checks for your child. For the adults, do your screening. Go and do your mammograms, go and do your pap smears, go and do your PSA, your prostate testing. So do these tests so that we can identify them, we get them early enough. And once we get them early enough, then we can treat them and we can get rid of them. There are persons who have, we have so many breast cancer survivors now who are living many years afterwards and living productive lives. So remember, cancer is not a death sentence. And this is where the Lions Club is very helpful, because there's some persons, like Ernie was saying, that yes, you have identified it, but I don't have the money. What am I going to do? So I've done everything on my part. I can't do anything else. This is where people from the Lions Club comes in, because they will help in terms of, providing finances, fundraising, making contacts, etc. that will help you to get your treatment. So it doesn't matter, where there's a will, there's a way. And there are enough facilities around, whether in Grenada itself or outside that, let's work together. And when we work together, we can get it done.
Right. Now, to me, there's a very important issue that I want us to look at. Now, a patient was diagnosed with cancer early, and so that patient was treated, and for all intent, they cured. So no cells were identified and all of that. Now, for the physician is one thing, but that patient, yes, I'm cured, but at the back of my mind, will it come back? Will I have to go through the chemo again and the nausea and possibly surgery? How do you deal with a patient, having finished or basically finished treatment, because for all intents they cured, but that little worry, that little stressor in the back of their mind keeps saying, if I get a pain in my back, I can imagine that maybe the little scare, the fright of any little pain you feel, oh boy, is it coming back? Or how do we deal with a patient like that? How do we treat them, care for them?
Okay, so the first thing is, even when we say you're cured and we stop your therapy, we don't discharge you. We still follow you. We still monitor you. So, a couple of years after we have said you're quote unquote cured, we're still going to be monitoring, because we're also concerned, is that the one cell somewhere that's going to come up? So even after we've stopped you, we will still monitor to follow to see what is happening. And then it is difficult, you know, when the shoe is on the other foot, it's different. So I can understand the person who is always worried and you know, so it takes time to be more comfortable, and I don't think you ever go back to forgetting. And as your physicians, we recognize that. I have one patient from many years now. He's now a dad. So he had leukemia as a child. When I met him, he was 6 years old, I think. And yes, he got cured, and we monitored him for a while. And then, he left pediatric service. He was no longer pediatric, and he went into adult. But they put him, his age put him in the adult, but every time something went wrong, he's like, he wants his pediatric team back with him.
Yes.
Don't touch me until you call my baby doctors. Which was, sometimes really embarrassing, because it's like adult physicians are calling, this patient is here, I'm calling him child, but he wants you all to give the okay. And, so we reassure him, yes, you're in good hands, they're taking care. And, he does it less and less now. And he's now an adult with a child.
Okay.
Working with telling them, yes, you're good, you can let go. And as they feel more comfortable, then they will let go. But they always know that, yes, you are my big stone. So whenever I want big stone, you can come back. It's okay.
All right.
But free to go out and explore.
Would you recommend psychological care? I mean, in terms of helping them to deal with situations like that?
Sure, that is a part of the management. So we touched mainly on looking on the cancer itself and managing the cancer. But in terms of the whole management, so you're looking on the psychological aspect of it. So we will need our therapists in to help them to work through it, both when they survive and when they die. We need a therapist there. We need our nutritionist that's there as well. We need the various therapists, occupational therapy, etc. So it's a team effort. It's not a one-man show. It is everybody together working with them.
Okay, so let's go to a telephone. I think we have a caller online. Doctor in call, good evening. Doctor in call, good evening. Hello?
Yes, good evening.
Yes, good evening. Could you turn the volume of your radio down, please, or TV? Yes, go ahead, please.
Turn on the volume. Okay, can you hear me?
Yes, we're hearing you. Go ahead, please.
Yeah, well, the question I want to ask is not for the child, but for adult. A male adult, if he's passing blood to his penis, is that a form of cancer, or is developing cancer now?
Okay, thank you very much for your question, caller. Doc, did you hear the question?
Yes, so the question was if a male is passing blood through the penis, is that a sign of cancer or not? It could be. Infections can cause blood, kidney problems can cause blood in the urine, infections can cause it, but cancers can also do it. And this goes back to what I was saying, that when you see a problem, don't assume it is okay and then you ignore it. So it doesn't mean that every time you see blood in the urine, you're going to hold your head and say, oh my Lord, no, I got the cancer. No, you don't do that. It doesn't mean that every time you see a lump somewhere on your body, you're going to say, oh yes, finally, I know the cancer is here. No, you're not going to do that. But you're going to be responsible, and you're not going to think it will go away. Let me watch it. No, don't watch your symptoms. Come into the doctor, let us check it. Some of these things are signs of cancer, but it doesn't mean because it is there, it is cancer. But the important thing is, because you checked it, if it was caused by cancer, we will identify it and we will intervene.
Okay, definitely. The number again, 435-2041. You can give us a call. We have a few minutes remaining. In the meantime, let me go back to Ernie, and just to talk a little bit again about the Lions Club and what they are doing. Well, just a moment, Ernie. Let's go back to a telephone. Doctor and call. Good evening.
Yeah, good night.
Yes, go ahead, please.
A question for the doctor. Now, a patient was diagnosed with cancer, diagnosed with a mass, right? I can't call it a cancer. She said it's like mass. And the doctor said that she should take 2 chemotherapy before they do any surgery, right? And after that she continue, her belly her stomach continue rising. And every week, every time she have to go and take out water. What type of cancer that is expected to be, Doc?
Thank you, caller. Doc?
That is a difficult question to answer. So if I can walk this person through some of what he's talking about. So he said the person was diagnosed. He mentioned something about a mass.
Yes.
So I'm assuming that this person felt a lump somewhere and went to the doctor, and the doctor recognized this lump was caused by a cancer. And the treatment was a combination of the chemotherapy and surgery. So yes, we do that sometimes. If the size of the cancer is very big, we give the chemotherapy first, so it shrinks the size to the point where we can do the surgery more safely. So sounds like what happened. So they gave the chemotherapy to shrink the size of the cancer, and then they removed the cancer. But he said, no, they're going to pull fluid out of the stomach because the belly is growing big. So my interpretation of that would be that when they removed the cancer, it had already spread, because the reason why the stomach is getting big is that fluid is collecting in the stomach, and that is because the cancer has spread around and is now causing the fluid to collect in the stomach. So the cancer would have already spread. So this would have been like a stage 4 cancer. So although they got the treatment, then it spread around, and now we're seeing the complications in terms of the fluid that you will have to be removing on a frequent basis to help the patient to be more comfortable. So what this patient would need to do is to, for the next visit, sounds like they need some more information from their doctor to explain exactly what is going on with me and my cancer, and have a frank discussion with the doctor. What treatment is there? What is the most likely outcome? Am I going to survive? No, we didn't talk about what we call palliative therapy. So we're talking about giving treatment to cure the cancer. Sometimes it gets to the point where we can't cure the cancer anymore, but we can make you comfortable up until your endpoint. So it's not only about curing, but taking care of you until you die. So sometimes we need to have that, we will have to have that uncomfortable discussion with you that we tried everything and it didn't work. So no, we need to make you comfortable because you're going to die. And you don't have to die in misery. I mentioned the family with the little boy that had the cancer, and we had the discussion. He was one of those that we ended up putting on palliative therapy. And there were days when he was in pain, really bad pain, and he had bad days, he had good days. But in spite of that, his spirit, like I said, his spirit was good. I mean, he lived with me for a long time. I still think of him very fondly, because I remember towards the end when his parents were looking on their son gradually going, there were days when they would come back to hospital because they needed the support. And I've never seen this in a child. When he looked at his parents and he saw how they were distressed, he decided he was going to write a will. He said he knew he was dying and he was going to write a will. And interestingly, he willed his body parts.
Yes.
And it was so interesting. He said, Daddy, I'm going to will my hands to you because when I'm gone, you're going to need help and you need my hands to help you.
Oh, boy.
Mommy, I'm going to will my brain to you because you will need comfort. He told the nurses, I'm going to will my feet to you because you will have my company. He died. But it was such a beautiful end to him because of palliative care. So it's not about only curing the cancer, it is about your quality of your end of life. So when we can cure you, that even when you're a child, you can write your will to comfort everybody when you're gone. I can't think of a better outcome than that.
That's wonderful indeed. Wonderful. One last question from our WhatsApp here. Someone says, good night. At what age should a woman stop doing breast checkup and pap smear?
Okay, so the current recommendation is that once you have let's see if I remember it correctly. I think it's past like age 50 and you've had like 2 or 3 negative tests, then at that point you can consider stopping because you're over, you've gone over that age and your previous tests have been negative. So if you're getting 2 or 3 negative consecutive tests, then at that point you can consider stopping. Previously we would say still go every year. As long as you're alive, go every year and do it. But we recognize that as you get older, if those tests are negative, then we don't need to continue doing that.
Okay, wonderful. Well, Doc, we're out of time for this evening. I want to thank you very much for taking time off to be with us and to share such wonderful information with us. That little story about that young boy, beautiful indeed. Very, very beautiful. So I'll give you just a minute or so just to briefly make some closing remarks on the issue of childhood cancer, and then we'd go to Ernie to make some closing remarks before we wrap for this evening. So Doc, we start with you.
Okay, just to remind persons that yes, cancer is no longer a death sentence. Cancer can be cured. Cancer does occur in children. Although we can't screen to identify the problem in the children, we can teach them the good habits that they will prevent cancers developing when they're older. And listen to your children, do their checkups regularly, that if they do have cancer, we can pick it up early.
Thank you very much. Ernie, any final words you want to leave with us before you?
Yes, I just want to encourage the general public to put on a gold ribbon or wear something gold in order to promote childhood cancer awareness so that persons will become aware and know how to deal with it, just in case it happens to them. I also want to encourage the public to support the Lions Club in any form. Whenever we go out there asking for funds or conducting fundraisers, we want to ask the public to support us. And if they have any requests, like any needy person, they can also contact the St. George's Lions Club. You can contact us on Facebook, SG Lions Grenada. You can also view the Facebook page and see the activities that we have been up to. So Godfrey, that's it. And I just want to thank you for a wonderful program. And also to the doc for a wonderful session.
Thank you very much again, Doc. Thank you so very much, and thank you, Ernie, for being with us. It was a pleasure. And Doc, I will be calling you again.
It was a pleasure to be here, and thanks to the Lions Club for the work that they've been doing and for their focus on childhood cancer for this month.
Okay, thank you very much, and do have a good night. All the best.
All right.
Okay.
Thank you.
Thank you, Ben. Well, that's our program for this evening, folks. On childhood cancer, you heard from Dr. Yasmin Allison Burnette and, of course, Mr. Ernie James from the Lions Club. I do trust that you have been able to pick up quite a number of things, and if by chance you are in that position, you are now better able to deal with it. So thank you once again, and do have a good night.
When you need...
Drug abuse.